Hi, and welcome to OneMedicine. This is a podcast for doctors, medical students, and postgraduates. And here we try to explore opportunities, build meaningful connections, and have fun along the way. With rising costs of medical education, it is very difficult for students to get into medical colleges these days. They are left with limited opportunities such as Europe or Russia. So, once you get into the medical education system in these countries, what is the exit pathway and what are the other opportunities? Let's try to dig deep into this topic today. And we have with us Dr. Rudrakshi Shetty, who has graduated from a medical college in Russia and has completed her foreign medical graduate examination. And she is here to help the young doctors who are studying outside to find a path. So, hi and welcome to One Medicine, Dr. Shetty. Today, as you know, we see a lot of people who go through foreign medical graduation and they find it very difficult to come back to India and practice because we see a lot of hurdles in the way, when they try to write the exams and a lot of that. So let's try to get a deeper understanding about that. But before that, let's get to know about you. Can you just tell about yourself?
Uh, yeah. So hi, I'm Rudrakshi Shetty. I graduated from Russia last year, and I cracked my FMG exam in January. I've been a part of medical extracurriculars for a while. I'd say around 3-4 years, and so I participate in health camps. I like volunteering even for extra medical activities, and I like to do yoga. And yeah, I have a couple of hobbies here and there, and I've been involved in medical writing as well for a while.
Oh, brilliant! So you've been doing all of that before you came to India. So you've been a part of all of these in the Russia as
Yeah,
well.
yeah. I've been part of Indian organizations only, but I did that before I came back to India.
Okay, that's brilliant. I mean, I did not know that there were medical camps that were conducted in Russia, as a part of your
No, 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 there
Indian.
weren't. But when I would come here, I'd volunteer. But even you need a lot of people to do like contacting people or like in the PR team and all of that. So I'd help with that sometimes. So
Oh, that's actually brilliant. Okay. All right. So let us know a little about what FMG is and how it's conducted and all of that.
it's an MCQ based exam, and there are 300 questions, and you have two sections, so of 150 questions each. And section one usually involves pre and paraclinical, and section two is supposed to involve clinical subjects. Although the lines are really blurred, they can ask anything from anywhere, but this is how it is generally. And yeah, it is not supposed. It's not a competitive exam. It's just an entrance. Like it's just a licensing exam. So they're just checking, I think, your baseline knowledge as to how you have studied all this while. And I think, yeah, that's it.
That's nice. So the exam, both the parts are conducted on the same day, or is it done on separate days?
Yeah, yeah. Yes, it's a 5 hour exam and it's conducted on the same day, although there is a break in between, but yeah, all on the same day.
Okay, so it's a 5 hour exam, so you get a break in
Yeah,
between. But do you get to go back
yeah.
to the part one before you submit the entire paper, or is it just part one separately and part two given separately?
No, no, no. You don't get to go to part one. In fact,
Okay.
recently the pattern has changed even more. So even in part one and part two, like instead of 150 questions, they have further segregated into 50-50-50 questions. So 50 minutes each. So once you're done with your slot of 50 questions, you cannot go back. I think this is done to prevent cheating and leaking of questions and that all of that. But yeah, this is like the recent most pattern.
Oh, okay. So that is good. So usually at what part of the year, during what time of the year is the exam conducted?
So it's supposed to be in June and December, but December session tends to get delayed a lot. Like even my exam was in January, and on the computer screen they kept writing December FMG December session. So it is
Right,
supposed to be in
right.
December and June, but it tends to happen in Jan. Yeah,
Okay, so it happens twice a year, right? Okay.
twice a year.
So,
Yes.
right. So, usually, how long do you take to prepare? Just walk us through how you prepared for the exam and how you cracked, and what were the hurdles and all of that.
Quite frankly, I like you have to study for the exam like you do like your university exams like you do always but if you like if I have to give like a definitive answer, I started properly preparing from my third year. Although like I got a subscription in my third year, so our course is of 6 years, and at the time I didn't know a lot about the FMG exam. I was still trying to navigate. So at that time, my aim was just to like get done with one subject properly with MCQ in my mind. So when you study for university exam, and MCQs are really not at the front of your mind. So I started doing that from third year, and I aggravated my studies, like FMG related studies, from maybe fifth year. So fifth, sixth year, and then 6 months after my graduation.
Okay, so maybe after the graduation you went full on with the preparation, is what you're telling.
Yeah,
So
yeah,
did
yeah.
you
Then it
get
was
good
just like,
amount? Okay. So do you get good amount of time when you're preparing during your course, or how was the course plan? Was it too packed all the time where you couldn't study at all, or did you get good amount of time in between?
I think it was really great for us. I can't speak of other countries, but I can speak for Russia in particular because it's a 6 year course, like I said. So in the first 2 years, it's really hectic because they have a lot of secondary subjects like economics, patient communication, ATCOM type subjects, and so we are like really in the institute from 8:30 to 6:30. Those are my university timings. So in first and second year, you barely get any time, and plus you're trying to get yourself accustomed to a new country.
Correct.
Especially like I had never been in a hostel, so it was really different for me. But as you go higher up, your classes like they reduce. So you just have your postings and you have lectures. That's it. So and you don't have a lot of your secondary subjects. You just have clinical subjects. So it's a lot more easier. I felt so, and then you have the rest of the time to schedule as per your liking, so you can self study, you can do other things. It's totally up to you, so it was quite easy for me.
Oh, okay. So you get a lot of time during the evening hours, and you can probably prepare at that time.
Yes, because in
That's
the
brilliant. That's
first 4 years they are teaching us Russian and all of that, so we have a lot of those classes as well, but after fourth year we don't have those classes, so it's quite easier.
Okay, so what kind of clinical exposure do you get there? And now that you have mentioned you learn Russian also, do you get to have a
Hmm.
translator when you write the exam, or do you at the end of all 6 years, maybe will you be sort of proficient with your Russian?
So our faculty was not Russian. Ours was an international faculty. So in our university there were two. One was the local and the international one. So the local one is in Russian, like everything, lectures and notes and exams are all in Russian. But ours was in English because we didn't just have like Indians, we had people from other countries as well. So we didn't need a translator during writing exams or giving vivas or practicals or anything. But when we have to go for postings, we need to know Russian, and hence uh, right from first year we have Russian classes where they start with like general, they try to ease you enough so that you can go around the city, like you can go buy groceries or you can buy tickets, and uh, it's easier for you to navigate around without any help. And after that they try to get you into the like medical terms, like what do you call urine or blood in Russian, and how do you speak to the patient, how do you ask if they're okay. So phrases, and also we'd have these workbooks where they'd share these phrases, how you can greet the patient, how do you speak to them. And yeah, so that was easy. And as for postings, they would tend not to leave international students alone. So it would either be like we would have our professor 99% of the times, and if not, we would have some Russian student who is proficient in English, so who can be like a bridge between us and the patient. Because even though we know Russian, but it's still not good enough, because if like a patient is in distress, and if we have to like ask the patient to repeat themselves over and over again, that's not a very good thing. So we'd have like someone to always neutralize.
That's very nice. That's actually very good.
Yeah.
So you sort of had somebody to support you throughout your journey in.
Yes, always. Yeah.
Oh, that's very nice. Okay, okay. So did you have these probably something like journal clubs or support groups where you could, ask and solve your questions? And how were the professors in general? Were they approachable, or was it very strict system where you could not meet or talk to the professors? Because that's what we see in India. So you see, when you do a medical course in India, especially the undergrad, you're sort of not
Hmm.
finding yourself talking to the professors. You kind of talk only to the postgraduates, and that's a practical aspect of what happens in India. So how is the
Right.
situation there? How was it for you?
Basically, in my like for my pre and paraclinical subjects, very honestly, I didn't find the professors to be very approachable. Plus, I think the main problem was, even though our faculty was like based on like English language, they were not as proficient in English. So there was always this like barrier that we'd face, or at least I'd face. I'll just speak for myself. But as we went along, like for clinical subjects, I don't know, maybe because my professors attended a lot of conferences internationally, so they knew English better. And I feel like they were far more understanding of our situation, as in they knew that 99% of us are going back to India. So they try to help us in the sense, like whenever they teach us, they tell us, oh, this is a question that was asked in the FMG exam, so this is a topic that you want to pay attention to. And they were far more approachable like further on. So if I have to talk like my pediatrics professors or my professors from internal medicine, they were too good. I couldn't say the same about my professors from like first and second year, but after that they were amazing. So I can't complain. Very approachable, even for like personal issues. Like if we need something, they'd be there. I've never heard anyone like criticize them that they were hostile or anything like that towards them. If I remember, we didn't have anything like that. We'd have conferences in our university, but like I don't know, like in India, in one city you can have more than one college. Or if I have to take a state, there are so many medical colleges just in one state. It's very interconnected. But in my entire state, ours was the only college, only medical college. So it's like too far off. There isn't a lot of communication between colleges. So we'd have conferences, but I don't know, it wasn't like as popular as it is or as crowded as it is like in Indian schools. So it would be a bit deserted and all of that. But we'd have conferences. I don't recall any clubs. There were a lot of like football clubs and like sports clubs and all, but academics related, I can't recall much. But we have a research club now after I've graduated. So so
Okay,
yeah.
okay. So you missed out on that
Mm.
opportunity there then.
Yeah.
You actually brought in two important aspects of the entire discussion. So you mentioned that 99% of the people go back to India. So what
Mm.
other options do people have, especially Indians
Mm.
who have gone to other countries, especially the European countries and Russia, where they get
Right.
their degree from that country, but it's not fully recognized in India unless you clear your FMGE, the Foreign Medical Graduate Exam.
Mm.
So what other options are there on your plate where you can, if for some people who find it difficult to do FMGE or crack FMGE, what other options do you practically have?
Um, I'm not sure, but I have seen many seniors who, like, if they didn't want to clear this exam or like they wanted a different route, they do like public health courses, MPH, in the US or New Zealand or Australia. I've seen a couple of seniors do that. But if they want something like hardcore clinical, so they'd have to like they take the PLAB route or the USMLE pathway. Now, even for PLAB, the catch is you need internship. So in Russia, we don't have internship on paper. So they'd still have to come to India and give the exam and show 1 year of internship for PLAB. But for USMLE, they don't have that. So if there are many of my juniors who are planning for USMLE, so that is always an option that's available. Um, I think these are the pathways that I've seen mostly people take.
If you want to go to UK or Europe, you should go to the PLAB route. But for that, you need to come to India, do your internship, write the FMGE, do the internship. So that sort of becomes a
Yeah,
bottleneck for them. But if they want to go to take the
yeah,
US route, they can just directly write USMLE exam and then clear it. If they clear it, they can
yeah.
match and go. That's very
Absolutely.
nice. Okay.
But it's like a really monetary intensive process, USMLE. Plus, you need to have like an amazing CV, so many publications, so many extracurriculars. So there are a lot of aspects to that as well. So if someone has been involved in all of this since the beginning, I think it'll be quite easier for them.
Okay, I'm glad that you brought that up because that was the follow-up question for me right now. So, from my side, so what are the things that you can do now that you mentioned you have from 8 to 6, you have your school or a medical college from
Mm,
8 to 6. You get your free time only in the
mm.
evenings, right? And so, what are the things that you can do or which you did, which would have an impact on your CV, which you can sort of build and be the best of the best, especially when you're an international medical graduate coming back to India.
The best thing that you can do is get involved in research. So you can either get in touch with your professors from your university, or you can get in touch with seniors from your university, or like online from LinkedIn, or there are so many Instagram pages that have these research organizations. So you can get in touch with them. That is the best thing that you can do. And if you have research, then you have the opportunity to present that research for like poster presentations and in all these various conferences. So that is also an option. If not,
So are these conferences in India or in the Russia itself?
anywhere. So it depends. You can do it in Russia if you study there. You can do it in India when you come back during vacations. Because I remember when I used to come back for vacations, all medical colleges in Mumbai used to have their conferences at that time. So they would have all these competitions, quizzes, and at the same time poster presentations as well. So that is an amazing opportunity. But there are so many conferences that happen. Suppose if you're aiming for USMLE, so it's always better to present there, because then you'd have like more credibility to your CV. So you can always submit your presentations there, and if you get selected, then there's nothing better than that. If not research, I think you can. There are so many student-led organizations I know in India alone actually. So you can always join that. Depends on what you want. Suppose if you're interested in OBGYN or pediatrics, there are respective organizations for those things where they talk about what residency is like. They conduct webinars and they have like health camps and so many different things. So you can join their team. If you can't be on ground, you can join like their PR team, their marketing, their research team, and you can still contribute. That's also an incredible thing that you can add to your CV.
Just walk us through how you prepared for the exam. We know you prepared in the last 1 year of your course where you were a little more serious about it. And once you came back, you took another 6 months of full-fledged preparation for FMGE. So with the same question, I would also want to ask, see, what next after FMGE? Most of the people do end up writing NEET exam, and they'll be trying to get a post-graduation seat in India itself. So if and when you're preparing for FMGE, where you study full on just for the FMGE, can you club the preparation for NEET PG also from your experience? And if along with that, what other things would you want to add, and what all sources can you use to prepare for the exam?
As to how I prepared for the exam, so my first aim was to finish all my subjects, like all 19 subjects. So in the beginning, I was trying to go hand in hand with my university, but then I started to pace up a bit, and I was ahead of what my university was covering. So I felt like I was on a good track. And once I was done with that, then now I knew I had to start with revisions. And I started to and I had to solve MCQs, because it is at the end of the day an MCQ based exam. So I had to like apply the knowledge that I had into an MCQ, and I started giving grand tests to check if like I'm on par with my preparation, if I need to modify something, and I started doing all of that. And with time I just kept aggravating my revision cycles. Like I started doing them quicker. I started focusing on my weak areas. They ask a lot of image based questions, so that is also something you need to focus on. It's not very difficult, but my weak areas were path slides. I'd get confused a lot, so I knew I had to focus on that. So I knew my weak topics, and after so many revisions, I knew what I had to focus on. So I started doing that. Yes, definitely NEET preparation goes hand in hand, because it's the same syllabus at the end of the day. It's just their style of asking questions is different, because one is a competitive exam and another is a licensing exam. So they're a bit easier on us in the FMG exam. So yeah, the questions are a bit different, but the syllabus is essentially the same. There is no difference. So it definitely goes hand in hand. If you can solve NEET questions, I think it'll be easier for you to solve FMG level questions as well. As for what people do after the FMG exam, so most of them await internship, they clear their internship, and yeah, most of them go for they appear for the NEET PG. But like I said, most people want to go to the UK or Ireland, so they go through the PLAB route. So after they're done with internship, they might do that. I've also seen people who start their USMLE preparations a bit late, so they don't want to show gap on their CV. So this internship, this 1 year helps them a lot. So in the meanwhile, they can give their step exams, they can work on their CV, because you'll see so many clinical cases. So you'll have a couple of case studies, case reports from it. and they do that. After NEET PG, I think it's the same. Like you have your MD, MS, you have diploma courses, and yeah, all that.
When you prepare for FMGE, it's better to prepare, especially if you want to do NEET. It's better to prepare
Yeah,
with NEET in mind so that you solve the tougher questions and it becomes very easy for you to crack FMGE, is what you're telling.
absolutely. Yeah,
It's
yeah,
very nice. And second thing is, if you're not doing that, make sure that you don't have a gap in your CV and do something or the other just to fill it up. And I mean, of course, doing something that is
yes.
legit and make sure that you try to get into research and stuff like this. Okay, that's very
Absolutely.
nice.
Because in India, they don't really focus on CVs that much, at least not at this level. But when you go to the US or anywhere outside India, they focus a lot on CV. So you have to explain every gap that you have. So you have to show that you were doing something, research or something else in the meanwhile.
So, what sort of cases do you usually see in your undergrad? So, is it the same that you see in India, or do you feel that there are a lot of differences in, especially since you've done it from Russia? Do you feel that there are any differences
Yeah.
in the kind of cases you see compared to India, and the kind of approach that you've seen? And what else have you
Mhm.
seen that is very differently done, both good and bad ways in India versus the other countries?
Yeah, cases were like almost the same. Like you have your diabetes and your hypertension in older population, but some things were different because I was in the north of Russia, so we would have a lot of frostbite cases. And because of these frostbite, we had a lot of amputations happening as well. So I have seen a lot of these, even more than I've seen cholecystectomies, like you usually do, in surgery. And that's there. Other than that, there were a lot of like ALD cases. Because alcohol was a big problem in Russia because it is so cold. People tend to drink a lot. My assumption is so that was also very common. Other than that, there were a lot of like drug abuse cases among the youth, HIV cases, and yeah, I think. I have not really stepped into the Indian healthcare yet, but I think this was, if I have to imagine, I think this is a stark difference.
Especially when it comes to frostbite, we hardly see that, especially in southern part of
Yeah.
India. It's non-existent. Maybe in the northern part it
No.
might be something of an issue, but definitely not. Yeah, when it comes to alcoholic liver disease, that's essentially the same. I think probably you see those kind of cases in India as well.
Okay.
As you mentioned, these colleges were far apart, and you were sort of
Hmm.
isolated. It was a small isolated pocket of doctors training in a very
Hmm.
restricted way. What kind of
Hmm.
networking opportunities did you have in the Russia? I'm not talking about when you came back to India. You did a lot of conferences. Were you able to connect with your
Hmm.
seniors, and what kind of networking options did you have there?
Connecting to seniors in your same college is very easy because everyone is living in a hostel essentially, since no one is a local there. But connecting with others, like from other Russian universities, like even Indians from other Russian universities, was very different, very difficult actually. I don't think I have connected with anyone in my time over there. But there are organizations still, although very few. But if you have heard of IFMSA, it is International Federation of Medical Students Association. So they essentially have like how do I say branches, if you must, in various countries. So in India it is called as MSAI. In Russia it was called as HCCM, and I was a part of HCCM. So that was a great opportunity because then I was in touch with students from various medical universities. So from Moscow, St. Petersburg, Ufa, or all of these places. But even in that organization, I didn't see any Indian. So I was a part of that organization for, I think, 2 or 3 years. Yeah, 3 years, and I couldn't get in touch with any Indian medical student over there, only Russian medical students there. So if time permits, that is an amazing opportunity for you to do. In fact, I felt it was easier for me to connect with FMGs through Indian organizations, which is like a paradox. I don't know how to explain that. But yeah.
Just a question off topic. So it was probably like thousands of kilometers away from your family and everything. So how do you cope up apart from your the friends and people there in the hostel and all of that? So how do you cope up with I wouldn't call it stress, I would sort of call it isolation. And what about the food? So did you find food a very challenging thing, or how was it?
Oh yeah, definitely. For isolation, I feel I am. like naturally introverted. So yeah, I felt lonely sometimes, but it didn't bug me as much as it was a problem for other people. But it's still not a very big issue because, like I said, we are in a hostel, so it's not possible for you to be alone because you have people constantly around you.
Yes, yes. The support system is what you need, especially during your young years when you've just stepped
Hmm.
out of college and you're going to a medical school. Uh,
Hmm.
the subject itself is quite complicated for you in the beginning, that you hardly understand
Yeah.
anything, and then you have
Yeah.
all fresh faces. You need somebody to talk to. It must be a
Yeah.
really challenging situation for a lot of people there.
Like people who are in India, like suppose they might be in a different state, but you always know that your parents are accessible to you. Like if something happens, they can like catch a flight or they can get hop on a train and they'll be next to you in a day or so. But I cannot expect that from my parents or my family members, but I can't do the same for them. Like they'll need visa and they'll have to book a flight. It's very complicated. So that's always there, the family factor. You get homesick a lot, but that is the toughest part, I think, in the journey. Food was always a big problem. So like I said, isolation was not an issue for me. Food was, because I had always been home. I knew how to cook in theory, but I never really cooked. So I knew like what goes when and how to cook, but I'd never done all those things by myself. So I was navigating that all alone. But yeah, like I said, there were seniors who were there to help. So we have like a common kitchen which a couple of rooms share. So suppose if someone sees that I'm doing something wrong or that I should do something else instead, they'll always come and they'll intervene and they'll tell you that do this, don't do that. Finding vegetarian food was really, really difficult. Not I'm not talking about like restaurants. That's like a big ask. But even if I have to cook at home, we don't get like fresh vegetables over there because it's Russia, plus it's in the north. They don't have fresh produce there, so they import everything, and we wouldn't find vegetables also easily. So that was always a problem for me.
All right. So if there are a couple of things that you want to teach your younger self or tell your younger self, or somebody who is very keen on getting into medicine, what kind of advice would you give to such people?
Okay, I think establishing a good support system over there, because, like you just mentioned, we don't have family there, so we are trying to create like a pseudo family through our friends over there. So initially, you want to be around a lot of people because you don't want to feel lonely, and it's like a very new experience. It's scary, but I didn't do that, and I'm very thankful. If I'd go to my younger self, I'd say the same thing. Just like find two friends who are genuinely good, who are not so competitive, who care about you and you care about them, and you can all be in harmony with one another, and just take that for those 6 years. I think that in itself is such a good thing. You don't need anything else. So if you've established a good support system, I think everything else eventually like naturally falls into place. You don't need a lot of things. And other than that, if I have to say anything to a junior, just like you are there to study, so focus on studying. Obviously, have your fair share of experiences. You travel because you're in a new country. You don't know when you'll be there again. So travel, eat local cuisine, do all of that. But everything should revolve around study. That should be the base. And I feel like if you're doing these two things right, survival there won't be a big problem.
Okay, all right. I think we can wrap up the conversation. This was a brilliant
Absolutely.
conversation. It was nice talking to you, and all the best for your future endeavors.